for having me here today, for hosting this. I'll tell you, we had one physician town hall at a hospital, that local hospital, scheduled and corporate canceled because they didn't want to create a hostile environment with their physicians. So, which is really frustrating because we've worked with this hospital for 14 years in discussions like this. I don't think you ever miss an opportunity to put physicians and medical providers in front of people who are supposed to make some key decisions. Let me get right to it. There's a reason why 12 medical associations, state medical associations, including Texas Medical Association, and 32 physician specialties oppose this health care bill, because bigger government doesn't always mean better health care. And there's real concerns about this 2,700-page bill and the impact it's going to have on health care in the future. Some of the things, we're learning more and more about this bill every day, and I'll tell you why in a second. But, some things people may not know is the one that actually discourages some businesses from providing health care to their workers. Here's why. The whole premise of this bill is everyone has to have government-approved health care. And every business has to offer government-approved health care, except for those with 50 or less employees for now. But the whole premise is government-approved health care. But in the bill, what it says is if you're a company or a medical practice that offers health care but it's not government-approved, you pay a fine, a tax of up to $3,000 per worker. But if you don't offer health care at all, your tax is only $2,000 a worker. Think about that. If you're a company that wants to do right for your employees, but it just doesn't hit whatever design they have, you pay more than if you just don't offer at all and pay that $183 a month. The worry is businesses are going to do the math on it. They're going to look at the bottom line and say, it's just cheaper not to offer it. Let our employees go in the exchanges and we'll pay for that. We're already seeing right now in this bill some things where they punish companies that provide retirement health care plans. You're seeing billions of dollars in new tax charges being identified every day. The concern is more companies, which we leveled off, by the way. Earlier this decade, the number of companies that were dropping the retirement plans was fairly steady, downhill slope. We put an incentive in the Medicare prescription bill to level it off. Now they've cut it again. Our worry is it's going to go south on us as well. Small businesses do get some help in this health care bill. The tax credits, I think, are good, but they're so limited. National Federation of Independent Business says about 90% of small business workers won't be eligible. And it's so tight the way it's drawn, we really, I think, leave out a lot of the incentives for covering small businesses, which, by the way, the biggest group of uninsured you see, they normally work for a small business, by the way. That was an area that I think they made a mistake in. Second thing, prices are going to go up under this health care bill. The mandates, driven mainly by the mandates, but also by cost shifting. The mandates in here, there are a lot of them in this bill. Some of them we all agree with. Covering people with pre-existing illnesses, got to do it. Lifting the lifetime cap on medical expenses, absolutely. Especially if you're a parent with a young child who gets a pretty debilitating disease early in life, you'll blow through that cap, there's no question about it. But the cost shifting, they put in place some things, community rating, which sounds wonderful, but what it means is everyone should pay about the same. And so younger workers and healthier workers are going to see their premiums driven up in this health care bill. And then the cost shifting, the worry is, in this bill they cover 32 million more Americans. And then they leave about 23 million Americans uninsured, still showing up in the hospital, ER rooms. But of the 32 that they cover, half of them they cover through Medicaid. They're going to increase the eligibility and move people into Medicaid. As you know, not the greatest reimburser in the world for health care providers at all. You lose money on everyone walking through the door. And the worry is that because of those losses, you'll see prices increased on where you can, because so much of insurance is pegged to Medicare as it is. The concern is that there'll be cost shifting driving up health care prices across the board. The worry we've seen is in Massachusetts, this is what's happened. Massachusetts has a bill very similar to this. In fact, that was a model for it. The good news is they cover almost everyone in Massachusetts. 97% of people in that state have health care coverage. The problem is that has driven up their premiums. They now have to pay the highest premiums in the country. They spend 33% more per patient just in the 3.5 years since it's been in place. Doctors are overloaded. The average time to see someone for a routine appointment to a primary care physician is now over 3 months. Almost half physicians won't see new patients. The Medicare plan, or the government plan they put in place to cover people called mass care, Dr. Tom, is running out of money. So when you get sick under mass care, they deny claims 4 times more often than the private plans that are in the state as well. And they're already starting to ration care. They're starting to run out of money. They put this in place in 2006, got it implemented the year or so after. So they've been in about 3.5 years. They've already started running out of money. So they started first with cutting Medicaid rates to providers, limiting reimbursements to doctors. Then they started withdrawing benefits to certain population groups. They started with legal immigrants in that state, but they already know they're running short of dollars. And there is, as you know, when you push people into Medicaid, there's been more utilization. So you're seeing concerns already about rationing in the state. So here you go, 3.5 years after that bill became law, you have higher prices, slower health care delivery, and they're starting to run out of money, which is exactly what I figured had been in the design of this bill as well. And that's a real concern for us. And the impact on hospitals is definitely mixed. Public safety net hospitals, because so many more people are in Medicaid, and they took the money that used to be the safety net, the equivalent of DISH, disproportionate share, they put that toward their health care bill. So public safety net hospitals have really struggled in Massachusetts. Meet Uncle Sam, MD. Federal government, especially the IRS, is going to be more involved in your life than ever before in 2 ways. One, because there are so many mandates and new taxes in this bill, 15 new taxes, worth $679 billion, huge tax increase on everything from Cadillac insurance plans, regular insurance plans, medical devices, everything this hospital buys, not at retail, will have tax on it. New taxes on professionals like you and small businesses that make over $200,000 a year. You're going to pay a new Medicare surcharge, and then for the first time ever, you're going to pay a tax on investment income in Medicare as well. All of which, by the way, the Medicare cuts, which I'll talk about in a minute, and the income, all go to pay for this. They don't go to strengthen Medicare. They go to pay for a new health care program. And because of these taxes, the Congressional Budget Office estimates the IRS will have to hire 16,000 new federal agents to enforce, again, government-approved health care and all the new tax increases. My thought is if we need 16,000 more of anything, it's 16,000 more of you doctors and nurses and healthcare providers in this country. We already face a shortage of 45,000 doctors over the next decade, 4 times as many nurses over the decade, and no provisions made to increase the number of physicians. In fact, there's a real concern in a lot of surveys that say physicians, because of Medicare, because of Medicaid, because of the cost shift or the shifting in this bill, will not see those types of patients. And some are considering leaving the practice. I hope not one does, but we're already getting reports in our district. We had 2 constituents contact us about their medical practices shifting to a concierge service. You know, that works if you can afford it, but it won't work overall in the healthcare system, so there's a real concern about that. Seniors are going to see most seniors are going to see higher Medicare costs. Some will see higher prescription drug costs. Here's why. One of the more popular programs in Medicare is Medicare Advantage, put together to offer an option so that, especially in rural, it was designed for rural and minority communities where there wasn't a lot of healthcare choices, to put doctor services, hospital services, preventive services, and medicines all in one package that's proved very popular. A million Texas seniors have Medicare Advantage. But under this plan, they slash about $190 billion out of Medicare Advantage. So 1 out of 3 seniors will be moved out forced out of their Medicare Advantage plan. Those who keep it will pay an average about $816 more a year to keep it. That's a concern for Texas especially. And then the prescription drug plan, in it they claim to close the loophole. They don't. But just to remind you how that works when we were putting the plan together, and I still think the reason I voted for it, still support it, is I'd rather spend a dime in medicine to keep a senior healthy than spend $1 later when they come to the hospital or come back to your offices with an illness that could have been prevented. I still think it's good smart medicine. But the way we designed it is we looked at Medicare, we looked at populations. About 90% of seniors we knew spend about $2,000, $2,100 a year on medicine. So we put an insurance plan together. Options, a lot of options, where you could monthly premiums, deductibles, copay. Then we looked at that 6% of seniors who will get a catastrophic disease, whose medicines are so expensive, $10,000, $20,000 a month, they can never afford it. Put a catastrophic plan to protect them so they wouldn't lose their life savings to pay for medicine. In between was a group, we said, the donut hole, we called it, where seniors are responsible for the medicines. What we put together 11 plans in Texas to cover them through that. What they do in effect in this bill is they get some discounts from the drug companies, but basically to cover those costs for seniors, they're going to increase the prices on 90% of seniors who never make it to the donut hole. Again, that's sort of the design of this bill. Increase the cost on those who have health care to pay for those who don't. It's not good, rather than focus on how do you lower the health care costs of everyone, period. And the impact, I'll tell you, I'm not one, I don't bash drug companies. I look at research for us here. I think it's almost a miracle given the expense, the time, getting through the clinical trials, human trials, FDA approval, finally getting a medicine to market is somewhat of a minor miracle anyway. But in this bill, the drug companies took a calculated gamble. They thought that if they put enough political capital behind it, they could reach a pretty good deal for themselves, and they did. They hired 1,105 lobbyists, poured $50 million into campaign in support of this. And out of it, they got a deal that said they'll give up some discounts for their drugs in the donut hole. In return, there is no reimportation from Canada or other countries, no government negotiating with health care prices, no price controls from the federal government, and they got longer protection of their brand name drugs, so generics, and the biologic generics will come to the market much slower than before. So there's only one industry we know of that everyone agrees is a winner in this bill, and that's the drug companies. Final point, the reason we have so many questions about this is, you may recall there were two bills that became law. One was the Senate bill, and that was followed by the reconciliation, the fix to it all. Senate bill was never intended to become law. They thought it was going back to the House. So it's so poorly written. Some provisions exactly contradict each other. Others are written so vaguely you can't figure them out. And some are written literally, written as my 5th grader running into class, late for his homework and throwing it on the teacher's desk. Some provisions of the bill look exactly like that. And the reconciliation bill builds on the Senate bill. So everyone's pouring through this bill to try to figure out what's going on. We've had 2 huge problems occur just in the first 2 weeks. One dealing with military and veterans care, another with children with pre-existing illnesses. And at the bottom line, what happens is, in each case, a federal agency steps in and says, well, don't worry, we'll fix the problem because we know what Congress intended to do. Our worry is that's exactly what's going to happen. Federal bureaucrats we've never met or know anything about health care will be writing key provisions of this bill depending on what they think Congress intended to do in health care. And at the bottom line, though, one question we don't have is that we know we can never pay for this bill. It is $2.5 trillion, first decade that it's up and running. Despite what some say about it actually creates a surplus, it doesn't. It's a deficit of about $660 billion in the first decade. The only reason they were able, on paper, to make it look like it broke even, one, because they dumped you as physicians. They took the $248 billion it would take to fix permanently the SGR for Medicare, which everyone knows has to be done. Everyone knows it. It was in the bill. They took it out because it made it look like it ran a deficit. So they needed to make it look like it balanced. So they, rather than cut those programs or stop their ambitions, they just dumped you. They take the Medicare cuts here, $500 billion Medicare cuts, a bulk of them to Medicare Advantage and hospitals, then home health care, nursing, hospice, diabetics, dialysis, things like that, and they double counted it. They took 500, they said it helped Medicare $500 billion, and it also paid those plans $500 billion. You can't do that. They took plans, a new entitlement called the CLAS Act, C-L-A-S, CLAS Act. It's designed to help provide long-term health care. What they did was they took the $70 billion it's a premium deal. You pay in, and then when you're ill later in life, the government picks up the long-term health care. Well, they took all the revenue from it and put it into this bill. They didn't account for any expenses later on when people actually need long-term health care. So this bill is a huge gaping hole. On top of the fact, we don't reimburse Medicare as it is. We don't fully fund it. We don't do it with Social Security. We're still struggling with veterans' care. It's also, so our worry is that we have put in place a new health care plan that we never hoped to pay for, poorly designed, hastily rushed through, with no thought to the infrastructure of healthcare providers who are actually going to have to deliver this product in the end. Other than that, it's a great bill. It will do lots of good things. No. Point is, everyone knows we need healthcare reform. We've been together in this room before on this issue, and we could do a lot better than this bill. So let's stop with that cheery Monday morning analysis. Let's stop.